Thank you, Mr. Chairman. Thanks to our witnesses as well for being here today. The coronavirus pandemic has affected the whole world, but there's no question its impact has been felt disproportionately by our elderly populations. Nowhere is that more evident than at nursing homes and long-term care facilities. We knew early on last year that the coronavirus spreads quickest indoors and at close quarters. We knew that those most at risk for complications or even death from coronavirus were the elderly and those with underlying health conditions. Sadly, nursing home facilities combined with all those worst case factors in one place. The overwhelming evidence was clear that just about the worst possible thing anyone could do was to knowingly introduce coronavirus into a nursing home. And yet, that was essentially the policy for states like New York, New Jersey, Michigan, and Pennsylvania, which mandated that nursing homes must admit patients who tested positive for coronavirus. These state policies ignored guidance the Trump administration released on March 13th, 2020 that said, quote, nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a COVID-19 case was and is present, only if the nursing home can follow CDC guidelines for quarantining. CMS Administrator Verma later said, quote, under no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs. Despite these warnings, governors of multiple states issued guidance and executive orders forcing nursing homes to admit people with the virus, thereby encouraging spread to those vulnerable populations. Such an abject failure of policy should have invited tough questions from the Democratic majority and the media. Instead, the national media rewarded New York Governor Andrew Cuomo with glowing talk about his handling of the pandemic, and he received an Emmy for his COVID leadership, while Michigan Governor Gretchen Whitmer was receiving vice presidential buzz. At the time, the media was quick to condemn states like Florida for opening its beaches and even branded Georgia's reopening as, quote, an experiment in human sacrifice. Yet after sending coronavirus patients into nursing homes full of vulnerable residents, Governor Cuomo was laughing it up with his brother in a softball interview on CNN. Pennsylvania's top health official took her mother out of a nursing home as the state was forcing the facilities to take patients testing positive for coronavirus, and yet barely a peep from the national media. On June 15th, 2020, I, along with other Republican members of the Select Subcommittee on the Coronavirus Crisis, sent letters to New York, Pennsylvania, California, Michigan, and New Jersey inquiring about their policies to take in COVID-positive patients. Mr. Chairman, I ask unanimous consent that those letters and their associated responses be entered into the record. Last year,
Without objection. So ordered.
Thank you. Last year, it was very disappointing to see my Democratic colleagues on the Coronavirus Select Subcommittee ignore these concerns and instead spend time questioning the safety of the vaccine developed under Operation Warp Speed, and even tried to bully many officials and experts associated with Operation Warp Speed with overzealous investigations into their backgrounds. Despite the political actions by the Democratic majority to attack the Trump administration at the time, we now have multiple safe and effective vaccines that are successfully protecting people from the virus and allowing businesses to fully reopen. At the same time, governors who ordered COVID-positive patients at the long-term care facilities have not been held accountable for their reckless actions. I would invite my colleagues on the other side of the aisle to join us in getting to the truth. Today's hearing would have been far better spent as a bipartisan effort to investigate COVID-related nursing home deaths and data reporting. My question to you, Grace, is how frustrated are you with the fact that Governor Cuomo ignored CMS guidance? He endangered vulnerable populations and then covered it up by undercounting nursing home deaths by as much as 50%. Let me just say for the record, I can't hear Grace. Let me just say for the record, I think it's appalling.
Can you hear me now?
I think we could have used our time in such a much better way on behalf of
Yes, we hear you, Grace.
You hear me? I'd like to answer
Mr. Chairman,
that.
I yield back.
I would like to
Witness
answer
is
that.
responding. Let
Thank
the
you.
witness
I would like to
respond
answer
to the
that.
question.
It was like a knife to my heart to hear the governor's callousness, him joking on late night TV, on his brother's CNN spot, avoiding questions about it. He has yet to say an apology to the families, although My mother always said, you apologize when you make a mistake. I do not believe the governor made a mistake. I think he knew the science. The only thing known from the beginning was that the elderly was the most vulnerable, and instead of isolating the sick, he put them in where the most vulnerable were. He always said he wouldn't put his own mother in a nursing home. So it was like a knife in a heart, and we really need to know why he did this and why he didn't follow the science.
Thank you,
Thank
Ms.
you, Grace.
Clerk, for your answer.
Thank you.
Thank you, Ms.
Thanks, Mr.
Walorski.
Chairman.
Let me say this. This hearing, I believe, has been objective from the beginning until this present moment. When you put people in jeopardy, whether you're a Democrat, Republican, independent, of course you're going to respond to that. You're talking about Governor Cuomo, and the record will verify or not verify when there is testimony. What about the governor of Florida? See, if you could pick out a state and you could say, you're putting people at risk if you don't follow the orders, and if you excuse me, you call it a hoax. Don't tell me. You made this political, and that ends it.
That is not the truth, Mr.
The
Chairman.
the gentlelady's time has expired. Based on the members in attendance and assistant with committee practice, we will move to 2-to-1 questioning. And now we